Welcome to the Caregiver Relief Podcast, the space where we come together to have honest, heartfelt conversations, share valuable resources, and support one another through every step of the caregiving journey. I'm your host, Diane Carbo, RN, and I'm so grateful you're here with us today. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. I'm especially excited about today's conversation. Our topic is Beyond Managing Decline, the holistic approach to senior care. I'm joined by Emma Soy, the founder and CEO of Gentle Shepherd Care, who brings a deeply personal and transformative philosophy to aging. Today, we'll explore what led them to create this approach and why helping seniors thrive, not just survive, should be our new standard. We'll talk about the critical mind shift from simply managing decline to actively supporting vibrant, meaningful life. We'll discuss the 7 critical mistakes family caregivers make and how you can avoid them. This is a must-hear for every caregiver. And we'll also cover some powerful real-life transformation stories that show what's possible when families choose a different path. The key takeaway for today is you don't have to accept decline as the only path. There is another way, one that honors the whole person and their potential at every stage of life. And remember, you don't have to do this alone. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. So let's get started. Emma, I'm so excited to have you share your concept on how home care should be. I see you as a pioneer in changing the way we do home care. It's a wonderful concept and a very timely topic, as I'm seeing so many unsafe discharges to home under the new Medicare guidelines. So welcome.
Thank you very much, Miss Diana. Thank you very much for having me today. I'm so excited to be able to not only share some of my ideas with you and your audience, but thank you for having me to even, I see that you're doing some great work. I am so excited about the work that you are doing for caregivers. So needed.
I'll tell you, I'm just disseminating information. You, on the other hand, are making a huge difference. And I can't wait to get into this topic because home care is becoming frightening right now. And your change, and having done home care, I can tell you what you're doing is you truly are a pioneer that I hope the world takes on, that you take the world on by storm. So Emma,
Well,
can you start by sharing a little bit about your background and what inspired you to create Gentle Shepherd Care?
sure. I've been a nurse for over 35 years. I keep saying over 35 because I stopped counting. And I know you are a fellow nurse, so you know what I'm talking about. I
Yes.
remember when I was the youngest nurse around, but now I'm like the old nurse around.
Hey, I'm
Um,
72 years old and been a nurse for 52 years, girl.
oh, wow. Yes,
So
yes.
you are a youngster to me.
Yeah, yeah. So you're a veteran. You're a veteran. So as a nurse, I've done how nursing is. I love nursing. Nursing gives us opportunity to be able to do so many different things, so many experience, so many different kind of experience that the opportunity in nursing. So I'm taking a lot of those different opportunities. So I've done different things in nursing. And one of the things that I did, I had moved from Chicago to here down south. And when I moved here, and I thought, with all the experiences that I've had, and I've worked in care as a care manager for a very long time. And so, as care management, caring for the older adults, I thought I'm going to continue to do that. So then I continued to do care management. But one of the things that I discovered was the home care piece that was missing. And so I decided to add on home care services. But my goal at that time was to help the older adults who wants to age in their own place, in their own homes, or wherever they call home, and to age in place, to grow old with dignity, to age with dignity, to thrive, to not just exist, but also have quality of life. Those were the reasons, those are the things that were going on in my mind. And when I started the home care company, and I discovered many different things. I discovered during the time that I started the home care, I discovered three things. Number one, very little. Most people do not plan on how they want to age. They don't plan on how they want to age, where they want to age, and they have no idea how much aging costs. And I want to tell you, aging in America is very expensive. And so when someone call me, a family member call me, mom or dad is 97, and they hearing for the first time home care services at $35 an hour, they having a heart attack. I'm thinking, well, this is the first time that they hear that. So those were the three things that I discovered. And I thought, wow, okay. That's a missing piece that we need to do in home care. And so you asked me why. This is why.
I worked in home care and I worked for out of Philadelphia, the Visiting Nurses Association. And what I saw, and this is 10, 15 years ago, and what I'm seeing now is frightens me even more. Medicaid for years has always had unsafe discharges to home. Nobody wants to provide services to anybody with Medicaid. I'm used to that, and you learn to work with that. But now I'm seeing unsafe discharges to home because of Medicare clients, because the reimbursement rates are changing. Now, you talk about a critical shift from managing decline to helping seniors thrive. What does that mean to you personally and professionally?
As I said, when I discovered nobody planned on how they want to age. And when I say how they want to age, I don't think people really understand that, like how you want to age. How you want to age means that you can just watch yourself decline.
Mhm.
You can watch yourself grow old with chronic diseases. The triplets, I called it. The three pills I always find in every older adult's pill box is something for their blood sugar, something for their cholesterol, something for blood pressure. So I find that most of them have something like that. I call it the triplets. And so you just take it as normal. You take it as normal. And people just watch older adults, they just, go down and decline. It's like everything that the older adult complain about, we attribute it to aging. We said the person is getting older, that's accepted. It's not. Aging is not a disease. Most of the chronic diseases that older adults are living with, we say to all younger people that they are reversible. But when older people have them, we tell them that they have to live with it.
Exactly. One of the things that I've seen over the years, first of all, I had a grandmother who lived to be 98. And she was a very healthy woman. And I can remember my grandfather had his first stroke when I was young. And we had no salt in the house. And when we learned that the government was moving, that fat was bad, and moved all the fat out of our diets and replaced it with sugar. So I can remember my grandmother serving ice milk. That's what it was called, not cream, but ice milk. And I grew up drinking skimmed milk all my life because we couldn't have that bad fat. And now here's the thing, grandma always had her cookie jar and candy jar. And I was pre-diabetic, and it's just because I was eating on the run. When you're a nurse, you do that, you don't eat well. I would like to ask you, what were some of the most frustrating things you saw in traditional home care that made you say there has to be a better way?
Okay, so traditional home care is this, Ms. Diane. Traditional care is this. Usually a family will call you The reason that I say family will call you because older adult will never call you and say, I need help.
Yes.
A family member will call you and say, my mom needs help because that older person, that the child of the older person's, it would be their responsibility, but because they work, because of the things that they have to do, they're not available, so they look for help. And usually what they're looking for help is activity of daily living. I need someone to help my mom with cleaning up in the morning. When she gets up, make sure she brushes her teeth. She takes a shower and she does not fall. She has a meal. She just has, she eats and she takes her pills. Usually, when a family member calls for home care, that's what they're asking for, the activity of daily living, and make sure that she's clean, her bathroom, and things like that. And that's what basic home care offers. Basic home care offers medication reminders, meal prep, clean help with personal care, light housekeeping. That's basic. When I started to offer those kinds of things, Miss Diane, I noticed that my clients keep declining. There are so many other important things that I could have been doing for them to
Yes.
keep them so they can thrive because these things do not help people thrive. They just help people exist.
Exactly.
And I found there are many things that older adults were missing and we were not providing to them. And so that's where I come with holistic home care. Holistic home care means that I'm approaching the care from body, mind, and spirit and everything that person needs to be able to thrive. Number one, most older adults' nutrition is very poor.
Yes.
Not just nutrition, but the nutrients. You talk about nutrition. Just because somebody eats a meal, that doesn't mean it's nutritional.
That's true. Very
And
true.
so when I looked at the nutrition of the older adult, most older adults, the nutrition is very poor. It doesn't matter whether that person is living at home or in the most prestigious independent living. Okay. Let me give you an example. I have a client living in an independent living. So the family called me and said, all she needs is she just needs medication reminders. She just needs some, she can do other stuff. She's still able. She can wash herself, take her showers and things like that. She doesn't need anyone else. She just needs medication reminders. Now, because I had caregivers in the building that can just pop in and make sure that the person take their medicine, we can do medication reminders. The son was out of town and mom failed. And he called me and said if I can go and have a caregiver take a look at the band-aid that the mom put in there. I'm like, she needs more than that. Let me go see it as a nurse. Okay. I go in there to check on the kid and the mom as a nurse. I found the mom. It was 98 degrees outside that day. It was 6 p.m. She still have a robe. This is the person he thinks can take care of herself.
Yes.
She still have her robe on. It's 6 p.m. She's been sleeping all day long. Her mouth is coated, dry. She had like an Ensure, a can of Ensure that was like halfway. That means that's probably all she had all day long. She hasn't had anything. She has a dog in the house. The place is full of pee and things like that. And she's all bubbly. She's all alert and then things like that. But she's losing balance. She's poor balance. She's walking around. She could fall anytime. And I noticed she hasn't had anything to eat all day. I look in her fridge, even though she lives in independent living who provided the meal. I look in the fridge, she has almost nothing in there. I go in there, I said, you need to be drinking. I give her a bottle of water. I said, we need to be having this water. I gave her some water and it was past dinner time almost. So I went downstairs to get her meal, to bring her dinner. I brought her dinner. Guess what they were serving that day? They were serving fries and a burger. So I brought to her a fries and a burger. Here's what I say. The time for fries and burgers for older adults are over.
Yes.
When we were young, they told us not to be eating fries and burgers. When we
Yes.
are 75, 80 years old, that's really the time you shouldn't be eating no burgers and fries for dinner. So there are so many things that we could talk about that dinner, that meal, but those are the kind of things that you see older adults. Their nutrition is very poor, so they're missing very vital nutrients to allow their bodies to be able to heal itself.
Yes.
When you give the body what the body needs, Miss Diane, you know that. When you
Yes.
give the body what the body needs, the body will heal itself.
Exactly.
So when older adults don't have the proper nutrients, yes, they are falling apart, but they're not. Remember, not only that, with the aging process. Now, if I'm going too much or too fast, let me know. I can slow down.
No, you're doing fine.
If you are the older adults, as you are aging, the way your body used to make things like cells, rejuvenating the cells or stem cells or things that to give you energy, you don't have that anymore. So you no longer, your body's not making it. So if your body's not making it, you got to be getting it from somewhere. So where do you get that? You need to get it from good nutrition, not just food, but good nutrition. So if you're getting that from the good nutrition, so then you can have the energy that you need. So you see, not only people, older adults are not getting the nutrition that they need, but they don't have the energy. So they become weak, poor balance. And that's where falls come in.
Yes.
So you have older adults falling. So you have the poor nutrition, you have the poor hydration, they're not drinking, and they don't have the energy, then they're not moving. So since they're not moving, then that causes them, it's become a cycle, right? You get the sleeping, you get all the stuff to take, and then they continue to take nothing. They take those pills for chronic disease, but those pills doesn't really take care of the chronic disease. It just manage the chronic disease. Does that make sense?
It does. And in fact, I will tell you that my listeners really need to listen and pay attention here, because seniors that are in independent living or in assisted living, no matter which one they're in, you need to, the families need to monitor them on a regular basis. Especially if they're not going down for meals in the facility. Or I tell people right now, I tell my clients all the time, assisted living is one of the most dangerous of all the medical deliveries. And all are shocked and say, why? First of all, it's based on a social model, not a medical model. Therefore, a social model requires that you're able to ask for help, direct your care, express your likes and dislikes. That's not always possible for seniors, especially memory care unit, which don't started about.
Yeah. But you know what, Miss Diane, I say, this is what I say to people. Every time, if you decide to bring your family to an assisted living, you need to bring someone like me, like a geriatric care manager
Exactly.
with them, because then we can help focus in the managing of the care of that person. And this
Exactly.
is the message that I have that makes home care different, Miss Diane, that I don't know how to bring that message to people to see the value. If you want your loved one to have quality life as they age, the care need to be managed.
Yes.
So the same reason that all the reason that family just call me for help them with activity of daily living, that's the whole reason why they place their loved one in assisted living too, is to help with that activity of daily living, because that's all they know that person need. The person need much more in order to thrive.
Exactly. I recently had a client that has a mother that just turned 104 in New Jersey. They flew back to New Jersey to see her, to celebrate. She is living alone in her home that she's lived in her whole life independently. And last year, they finally, because I've been working with them, they finally got her to agree. She has 7 hours of help every day. And what are they doing? I said, look, you don't want someone to come in and just sit there with her. Get them to have an activities list, make sure they're making her a good meal, because people eat better when they're with somebody versus alone. And that's why community eating is really nice. But for a lot of people, for seniors that are depressed or have other issues, they may not have the initiation to even walk down to the cafeteria or dining room area to eat, because it's just not in their heart to do it. And they need someone to nudge them along. And that's what I see makes a big difference as well.
And Miss Diane, I say that families, if they knew, and this is what that I'm working on, if they knew what a geriatric care manager could do for their loved ones,
Yes.
If I don't talk about every other geriatric, I'm talking about me, like what
Yes.
I do,
Yes.
managing chronic diseases, help manage the health of the older adults. I
Yes.
don't know how to express that, how to explain it better than to say every older adults need to have a plan. Like how I can give you the plan and you can implement it or someone else can implement it, but it cannot be continue. It cannot be basic. Mom eats. What is she eating? Okay. The other day I went to somebody's house. You know what they eat for breakfast? Cheerios. Oh, no, stop that. Cheerios for breakfast. Why are we feeding older adults Cheerios for breakfast who already have borderline Alzheimer's dementia? Sugar,
Yeah.
building that inflammation in the brain. Why are we doing that? So
Yes.
if you want the person to thrive, now that is if you want to. This is not for everybody
Yes.
because you can continue the train. You can continue to do the things that you do now. Eat your Cheerios, eat your burgers for fries for dinner. It's just then you're gonna have the life that you have now. What is it? It's the chronic, it's the decline where the person is unable to do things. Now, who wouldn't want to just keep on aging and still be able to be independent? Every time I speak to someone, that's what they want. Somebody they want to be independent as long as possible. What keep people from being independent as long as possible? Number one, it's the if the brain doesn't work. Number two, if the body doesn't work.
Yep. What people don't know, my listeners may not realize, is seniors don't get enough protein. And
Oh, yeah.
with lack of protein, we have muscle wasting. And really good. I have worked with seniors in their 90s that were still lifting weights. There's a lot of things that people can do. My grandmother exercised. I know you don't know who this is. Jacqueline was
Yeah, I know who Jacqueline is. Yeah.
okay, before Richard Simmons was Jack, and my grandmother exercised with him every morning, and she walked everywhere, which is unusual in the States. And she's an American, a pampered princess even, but she was very healthy and very active, and they had a very active social life even well into her 90s, which is awesome.
It's just the same thing when you hear the blue zone. When you hear talking about the blue zone, different part of the world. The blue zones, you know about the blue zone.
Yes.
Yeah. The blue zone is areas where older people are aging. It's chronologically, but they're biological. They're still doing things that they used to do. They're still doing
Yes.
gardening. They're still doing carpenting. They're still doing different things. And why? They attribute it because of their lifestyle. Number
Exactly.
one, the stuff they eat.
Yes.
And so you have all those people that are living in their hundreds who are
Yes.
living over 90, 100, and still because aging is not a disease. Just because somebody's aging, that does not come, just should not automatically come with decline.
Emma, I want to talk about the 7 critical mistakes family caregivers make. What's the biggest one you see over and over again?
Over and over again. The number one mistake older families are making, the number one mistake families are making, number one, is caring focus on daily just task, ADLs.
Yes.
They think all the family need is the daily task. And if they can keep on clean, if they can keep on to take their medication, and they think that's all they need. And that's not all they need. Not
I
if,
see
not
that.
if you want them to thrive.
Yeah, and life is more, it's interaction, it's social interaction, it's exercise, there's so many pieces involved to living. And
There's so much more involved in living beside clean me, wash me,
yes,
feed me.
yeah, exactly. So tell me, Emma, how does the gentle shepherd model help families avoid these mistakes?
Number one, they need to be educated.
Yeah.
Okay, so that was the number one mistake. I have 7 and they can get a copy of it. But number one, and every time I think we're talking again, we have 2 other series and we'll
Yeah,
cover
we have
these
2
as
more in
well.
the series. Yes. Yes.
But they need to be educated, number one. They need to change the mindset of older people. Just aging is a disease.
Yes.
They need to take responsibility because most of the number one issue that I see people do, Miss Diane, is people not taking responsibility for their health. They turn over their health to Dr. J, Dr. George, Dr. John,
Yes.
Dr. this, Dr. that. I love Dr. John. I love Dr. George. But let me tell you, in the healthcare system, we take care of sick people, not well people.
Exactly.
So our model is always looking for disease. If you don't have a disease to treat, there is nothing to do for you. And then we disregard the invisible signs of things of aging that we can help people with.
And doctors, in all honesty, right now, it's not like the old time doctors come in and they get to know you and know the family and know the situation. Doctors are supposed to get in, evaluate you, assess you,
Write your prescription.
write you a prescription all within 15 minutes.
Yeah.
And that's what Medicare reimburses for. And people aren't getting the quality care. And nothing makes me crazier. And I tell all my clients, you have every 6 months, you should be in the doctor's office with your med list, reviewing it and saying, what can I take away now? Or what can be discontinued or what can be decreased? Because I'm finding that doctors don't take time to review these things. So we as consumers should be taking responsibility for our own health and our own actions,
Yeah.
saying,
Yeah.
hey, do I need these? Can I get rid of some? Because as we get older, we metabolize our medications differently and
Yeah.
we respond differently. I have people that take 20, 30, and 40 pills a day. That's
Yeah.
absurd.
Yeah. Yes. Yes. Pills become the other meal that other people have because they have so many things that they take, like in the morning for dinner and all that stuff. But Miss Diane, you said something. You said two important things that I wanted to get back to. You said older people don't. So you asked me the mistake that families make. Number one, I said the focus is wrong focus. The focus is not clean me, wash me, might take my medication. The focus should be health.
Yes.
The focus would be how healthy. Now, here's the thing. I will talk to somebody about who I am, what I do, and they say, well, my mom is 80 and she's doing well. What do you mean she's doing well? What are you using? What measure are you using to say she's doing well? She's 80 years old. Chronologically, she's 80 years old. Do you know biologically how old she is? What have you done to say she's doing well? So now you're waiting until she falls. You're waiting for the fall. And then now she falls and then she starts to decline. And then you say, well, she was doing well until the fall. No, she wasn't doing well until the fall. She's 80 years old. And so unless we're doing things like those things, the foundation things like nutrition, the hydration, the sleeping, the nutrients, the replacement, unless we adding important things, we're taking things that needs to be taken, we are replenishing the body. Unless you're doing these things, you cannot tell me your mom is doing well at 80.
Exactly. That's very true. So tell me, Emma, what's the difference between a holistic senior care and conventional care models?
Yeah.
And
So,
can you give us some real life examples?
The conventional care model is the person who comes to me who wants, like that, like I told you, help my mom with the activity of daily living, clean her, feed her, and that's what you want to pay for. That's all you want. The holistic care is where I come in. I do a complete assessment. I look at the person biological age and chronological age, meaning that if they are 80, where are they biologically? And next time we can talk about the difference so people know the difference between biological age. I may as well cover that. Biological age and chronological age. If you're 80 and now with technology, Miss Diane, oh my God, so many things that we could do. We can see how old you actually are.
Yes.
So like right now, today, I'm 57, but I'm 42 biologically. Why? It's because of the things that I do. My body function as a 42-year-old. If I don't take care of myself, my body could either function as a 57-year-old or a 67-year-old.
Exactly.
Because biologically, the different parts of my body, either my brain or my body, that's how old I am. Does that make sense? And that's what's causing my decline. When my biological age does not match my chronological, my goal is to either have your chronological age match your biological age or go back.
I have taken care of, here's a perfect example. I'm in a very upscale continuing care retirement community in Philadelphia, outside of Philly. And the lady that is a research scientist at 97 years old, and she was having a hip replacement and going back to work as a cancer research
Yes.
at
Yes.
98, and she took one pill.
Mhm.
One pill. And I've had so many in my life that I have had that they've made those life choices, and it's really affected them as far as their quality of life and what they're able to do. So people don't have to age and have dementia. They don't have to age and have a lot. Some dementias are preventable, and people don't understand that. You're talking about vitamin deficiencies. Oh my Lord, yes. There are over 100 different dementias. And with those, some of them are reversible.
Yes.
The ones where the poor nutrition is one. It's very big, and people don't realize that.
Yeah. So you were asking me what the focus is. So the focus is I want to look at the person from a holistic, not just do they need the food, they this and that. So I look deeper. I look at the biological age, the chronological age. Number two, we look at all their labs. We look at the markers, the aging, the markers, they have age markers, the markers of aging. We look at those to see where the person is. What can we do with them? The A1Cs, the inflammation levels, and all that stuff. We look at their hormones levels. So when we look at those to see where are they at, because I want to know, because those are the things that are going to cause your decline. So I look at the age, the markers, and I look at your biological age, and then now we have something to work with. So based on those findings, based on your lab, based on those findings, then we start working. We start working on what do we need to do. And then our five little method is we make sure that the nutrition, the hydration, the sleep, the mobility, and manage whatever the chronic disease that you have. How can we manage it holistically as much as possible?
I like that approach because people don't understand that. I recently had an interaction with a home care nurse I was angry. I was really, really angry. And I was trying to compose myself, which I don't always do when I see incompetence. And I had a neighbor that was sent into the hospital for seizures. She was having them, she's 15 years post a heart attack where she had not enough oxygen to her brain. She's probably having these seizures over the last 15 years, but they have been ignored or not picked up on. And she goes in the hospital. A UTI triggered her seizures. So we have all this stuff. She gets discharged home, and the doctor in the hospital doesn't have, or the discharge planner, which having been a discharge planner and care manager like you, I'm like appalled. She didn't order a home care nurse. She ordered this lady PT. Now, I had to scream and holler and yell because they said, oh, she doesn't need a home care nurse. Oh, this is when I say you need outside case management like you, because what I found was that the nurse, they didn't give a nurse. And then when the nurse came in, she didn't address her seizure medication and she didn't address her urinary tract infection, which it turns out she kept telling us, even with her short-term memory, and she's young. This lady was in her early 60s. She kept saying, I know I have a urinary tract infection. And everybody poo-pooed her. And they sent her home like that. Long story short, I had to have the agency send out a nurse. She opened it, didn't address any of this. And I'm like, she's on new seizure medications. I said, you need to do a urinalysis because she said she has a UTI. She doesn't have any symptoms of a UTI. And I went, I don't care. I said, seniors don't always show symptoms.
Except for their seizures or their confusion and whatever.
And I know she's thinking, oh, this old nurse, she's just being a bossy bitch. Well, welcome to my world.
Yeah.
So she did have a UTI.
Yeah.
People don't know what they aren't what they don't know. The families don't know what they don't know.
The families do not know what they don't know. And
Yeah.
so that is why I said what you're doing is very important, Miss Diane, more than because families are sent home with very little knowledge of the care of their loved ones. And to be able to have
Exactly.
someone like you providing the professional education for families like that, this is priceless.
Thank you, Emma, and I appreciate that. But you know what? I have seen so much happen in healthcare, the decline in healthcare over the years. And that's why I keep doing what I'm doing, because family caregivers are now 63% of family caregivers become seriously ill or die
Yes.
before the person they're caring for.
Yes. I cannot begin to tell you the frustration that I have
Yeah.
when we cannot bring this message that this statement you just made
Yes.
to a family caregiver for them to accept and to say, whoa, that is true. I need help. Help me.
Here's something that will really be a wake-up call. When I started my first website 20 years ago, it was called Aging Home Healthcare. At that time, 50% of family caregivers were becoming seriously ill or passing before the
Mm.
person. So it's already jumped up to 63%. And now with the changes in Medicare reimbursement, the family caregiver, we're just going to be killing them off all around. That sounds terrible, but
Mhm.
it's unrealistic. We have no affordable respite care. We have we have people that have no background in healthcare at all being expected to provide care
Yes.
that is
Professional care. Yeah.
Yes. Once
Professional care.
completed.
Yeah.
Yes.
Because I don't think people know what we do as nurses.
No.
They probably just think like we pass medications, not knowing that the critical thinking that we put it in everything. I'm talking about nursing our age. I'm not talking about the nurses today
Yes.
that is who goes take care of someone who has a wound, but that nothing tells them that they need to do a wound culture. So I'm not even talking about those kind of nurses.
Yes. 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 When I see a wound, what do I think of? Oh, you got to increase the protein. You got to get some zinc and vitamin C in them. And I look at it from a totally different perspective than the new nurses out there that
Yeah.
don't have time to do that kind
Yeah.
of thing.
Yeah. And then we have to look at what reimbursement is doing to people too. The good thing is the service that I provide is private. That is for the person who wants that extra help, care for themselves, and who are willing to pay for that. And a lot of seniors don't have that, a lot of families don't have that extra money. They depending on the support of reimbursement from Medicare or insurance to cover, which insurance do not cover and Medicare do not cover. And the cut is cut is cut is cut. I remember when I used to do home health 100 years ago, where as a home care nurse, I could go to somebody's home for like a whole year to make home visit and things like that to make sure these things are done. Nowadays, it's like I don't know what they get, like couple visits, couple
Oh,
nursing visits.
just a couple. And even OT, PT, and speech are almost nil, and it's really sad.
Yeah.
So, Emma, how do you train or guide caregivers differently in the Gentle Shepherd approach?
So the way I train them approach is this education, right? So my dream is to be able to offer continued education for families that are under my care so they know what's going on with their loved ones. If they are interested, again, as I tell you, I don't know if it's society see older people so different than I see it or than how you see it.
Yes.
That's what I'm trying to do, to educate families, not only how to care for the loved ones, but to bring these kinds of ideas to the ones who care to wake up, to stop, to it's like an interruption because this is the trend. This is how people think about aging. And I come in with this other thought and said, no, aging is not a disease. And then people are like, what? What? Okay. Just because somebody's 80, 90, that doesn't mean they need to decline. You need to put them in a nursing home or assisted living. If you're bringing someone to an assisted living, bring me with you so I can create a plan of care of how they need to treat your mom and dad. And that makes me go like, why? Why would I do that? I tell them, if you're already paying this kind of money for an assisted living, why don't you make sure that this is the care you get?
Yes. You know what? That's the other thing about assisted living that I think that people don't understand. You're paying big bucks. I mean, big bucks to just have independent living. You have nobody there in the building, or if there is, there's one nurse that will be called in if you put it on your fee schedule, because everything is a la carte. So if you need meds given, that's paid extra. If you want laundry services, that's extra. You want a blood pressure check, that's extra. So
say it louder, because
I know.
people in the home, I don't know, from my area, people think the solution is assisted living.
Oh,
Okay.
no,
They
no.
keep thinking like, oh, home care is very expensive. Let me bring my loved one to assisted living because they have 24-hour care. That is not 24-hour care. They have
It's
no
not.
idea who's taking care of their loved ones. First of all, like you just said, they have one nurse in the whole building. What? She's not working 24 hours a day. Okay. They're
Yeah.
going to call her if something is needed. Well, me too. I have a home care company. I have a nurse on 24/7.
Yeah.
So if something is at home, they need something, they can call a nurse to talk to a nurse 24/7, just like the assisted living. There is no difference because the nurse is really not seeing your mom every day.
I will tell you, I was a DON, a director of nursing, in a very upscale, very posh, wealthy section of Philadelphia. I mean, it was the Steinway in the lobby, the wait staff in the dining room with their hats and all that fancy garb. And it was one of the most unsafe places I ever worked.
Mm, yeah.
And when I tell people that, they're shocked, but I have horror stories and I will share them at another point, or if somebody's interested, I'll talk to them about it. But
We'll talk about it. Yeah.
yeah, but I do want people to know that what you're offering is home in the care in the home that not only makes a difference and provides services, but you're doing it probably at the same rate or a little, if more, at least you're getting better quality care than if you were
Yes.
assisted living. I already
Yes.
know that.
Yes.
I know.
Yes. It is more. It is more to care when you're getting care, but you're getting Cadillac care. Don't compare Nissan with Cadillac because you're talking about comfort. You come in.
Yeah.
So if you're looking for quality and comfort, it's always home. It's always home. And if you're going to take your loved one, and I'm saying if you have to, because a lot of times families have to do what they have to do. If they have to go to assisted living, that's why I said bring someone like me as a care manager. I can support someone anywhere. What
Yeah.
does that look like, Miss Diane, if you take me to an assisted living with you? I oversee the care of your loved one. First of all, we'll create a plan of care of what you want, right? Now, part of it is you want quality food. For example, nutrition, because not everybody should be eating the same food. For example, if you want somebody to have nutritional food with the kind of nutrients that you want them to, you have to pay attention to that. Don't just throw that. Don't just leave that up to the beautiful assisted living, because this is important to mom's life. This is how she's going to thrive if she doesn't have the proper nutrients. So we're going to create that. We're going to create everything that I create at home. I'll give it to you so your mom can have that in assisted living. And I will supervise it to make sure that it's being done. So that will cost you an extra $1,000 a month. Well, you're already paying $10,000 a month for assisted living, so you may as well.
Emma, what clients and my listeners don't understand is that we are in a public health crisis. We don't have enough people to take care of our elderly. And it's a very serious issue as we have this silver tsunami. The baby boomers are retiring. The youngest of the baby boomers are retiring by 2030 or will be at retirement age. And the oldest of the baby boomers are turning 80 in 20. So we've got all these issues that we have to face. And what I'm seeing, Medicare is moving to an accountability care organization. That's a joke from the government, I think, misnomer, but I won't go there. I will tell you right now, what they're doing is it's going to be a cost-sharing plan. So you are a person that if you want the care that's being recommended, you need to have somebody that is willing to pay for it. They'll say the government has become in between the doctor and the patient. Government is the gatekeeper for everything, and they've screwed up our healthcare royally. What was a good program where we did provide care for even our poor. And I saw it all the time. I was always proud of how we provided care. Since managed care has come in, like Obamacare, forgive me,
Mhm.
are
I'm
not
with you. I'm with you.
don't have that safety net anymore,
No.
so that nobody's getting good care.
Yeah. Can I tell you the sad thing is? Here's the sad thing. I have my son who's in med school. Okay.
God bless them.
And I was talking to him about my holistic care approach. And he said to me, now remember, he's in the system already, right?
Yeah.
So he says to me, Mom, this is a good idea, but who's going to pay for that? That's number one, he says. Number two, he says, Mom, I understand that this is a good idea that you're saying, but we don't see old people like that.
Where's he going to school?
He's at Chapel Hill. He's in med school. He says to me, Mommy, society don't see older people like, and he's just telling me the truth.
Yes.
So to him, he said to me, this is such a dreamy world you're in, because you're talking about a topic that's not how we look at older people.
Yes.
And so I see it in the eyes of people as I explain this. Number one, the older person themselves, Miss Diane,
Yeah.
kind of give up on that. They're not going to be doing this. All the stuff that I'm telling them, they're really not motivated. Some of them are not really motivated to do any of this. They're like, oh, whatever.
They've given up. They've given
Yeah,
up.
kind of given up. My sister's gone. My wife is gone. My husband is gone. Whatever. I'm just waiting for Jesus to call me home, kind of thing, right?
Yep.
Children are too busy to say, what? Like, what? Okay, I just want to make sure she doesn't break her hip, kind of thing. So
Yeah.
I'm looking at it. When he said that to me, I'm like, yeah, I'm probably preaching not to the gospel at all. I'm not to the choir at all.
Yeah.
But I'm hoping the more I speak this, someone will listen and somebody will stop. Again, I'm stopping people from their regular thinking to
Yep.
make people think that there is a better way of taking care of older people instead of letting thrive and let them just decline. Like
Yeah.
I had a patient who told me she took care of her mom at home. And she said so many times the doctor told her, there's no way you can do this. This is too much. You need to put her in assisted living. You need to, she said, and I used to take care of her mom at home. And she never told me she was looking for assisted living. She said, Emma, I never told you. But she said, so many times I visited so many places. She said, one things that I saw, it was so lonely. She said, I go to those assisted living. And I said, those people they were doing nothing but watching the walls, Emma. She says, nobody combed their hair. Emma, she said they were just glaring. And I thought, wow, I cannot have my mom like that. Now, Miss Diane, those are the daughters that I'm talking to today. The ones that really want to give their mom the best of care, even at on their last day on earth. Her mom was in hospice, and she says to me, you know what, Emma? The hospice nurse was caring for my mom as though she was dead, but I was taking care of her so she can live, even though not just because I know she wasn't dying, but while she's here, she's living. I needed her to live.
Emma, I'm going to share a story with you about my father. My father was a letter carrier, and he worked hard all his life. My mom died when I was a freshman in nursing school, and she was young. She was in her 40s, and I was only 17, so I'm the oldest of four. Anyway, my dad gets us through life. We all graduate. We're all productive human beings, and he's retired. And he had bought into a timeshare. And every other year, he would save his weeks so that he had 6 weeks and he would go to Hawaii. And he loved Hawaii. It was his favorite place. So when you're talking about hospice and stuff, my dad received a diagnosis of pancreatic cancer after a Whipple procedure. So you know he was bad. And the doctor said to him, Lee, you only have a few months. And the first thing out of my dad's mouth was, oh no, I'm not going to get to go to Hawaii. And I said, wait a minute. In front of the doctor and everybody, here's me, the bold nurse that, the bossy little sister. I said, Dad, you're not dead yet.
Yeah.
And we're living in Pittsburgh, Pennsylvania. And I said, Dad, if you feel well enough to go, we could put you in hospice over there just as well as here. So if you
Yeah.
want to go for 6 weeks and you're feeling well enough to travel, then you go. So he did. He was able to go. And in fact, when he was in hospice over there, this is why I know exactly what you're talking about. They took him off hospice the first week because he had this rejuvenation of spirit,
Mhm.
had an amazing 6 weeks.
Mhm.
Day before he was, and I said to him, Dad, if you pass over there, I'm okay with that. Are you
Yeah.
okay with that? We're a big family. They're all screwy. You do what
Yeah.
you want to do.
Yeah.
And he said, if that's fine. So we agreed to that. But he came home and he died
Mhm.
a few months later because he was laid out in a Hawaiian shirt and a lei. But you know what? I can tell people right now, you can live life up until the end, even under hospice. Now, hospice
Yeah.
now wouldn't even think about letting you do that because it's all about reimbursement. But I can tell you, yes, that I tell people all the time, you live life until your very end and have the ability to do that with the right approach.
And then the thing is, with hospice, Miss Diane, just because if somebody's hospice, the kind of care that you want, like your mom, let's say your dad wanted to go to, anybody wants to go to Hawaii, they don't need to be signing up. They can pay for hospice. They can pay for somebody to provide end of life care to you
Yes.
wherever you are. Because the reason that you sign up under hospice is so they can get the benefit
Yeah.
of them paying for it. But that end of life care can be provided by any provider.
Well, absolutely. The big, big growth of death doulas and end
Yeah.
of life specialists now.
Yep.
There's a whole holistic approach.
Yep.
And the holistic is the key here, Emma. And that's why I love your approach to care because we have a growing army of healthcare professionals that are concierge nurses, concierge therapists, OT, PT, and speech, because they are going to provide care for those that can pay for it and want
Yeah. Yeah.
because we are seeing families being expected to provide care that once was provided by healthcare professionals, and it's very dangerous right now, and it's
Yes.
going to get worse.
Yeah. And that's why, and those are the people that I really want to talk to, the people who care,
Yes.
the people who want something better, someone who can afford it. Because yes, we do need to pay for the professional care. And so, yes, it is out of pocket. It is, but we do provide the care that is not comparable to the basic care that you receive, which is clean me, wash me, take my medicine.
Yes.
Because
There is
that,
life to be lived if
yeah,
people will put processes in place
processes, yeah.
to live your life fully.
Yeah. Put a pathway. We have a method. We have a pathway. That's what make our home care different. It's not just like when we go on the when, oh yeah, wash me yeah, this is part of it, but there is so much more to living and
Absolutely.
thriving beside clean me, wash me, and take my meds. As I said, you could eat. What are you eating? Cheerios is not meal. It's not fit for old people. Hot dogs and burgers and fries are not the meal that we
Social
feel.
energy.
That should be an older adult's schedule. In all the other parts of holistic care that comes with it. The sleeping has a whole, and next time we'll talk about that. There has a whole process for these kinds of things. So nutrition is the one that I wanted to talk about today. And yeah.
Now, have you seen any transformation stories that stand out, Emma? Like where a family or a client made this shift and saw a major change?
So I have I have a client, I had a client, she passed away, who lived and again, this concept is very new that I'm trying to get people to accept because this change take time for people to accept. It's a new model. When people hear, oh, I have to pay extra, and they're like, okay, give me the old one. So it is a process. Yeah. So I have a client who used to live close by, and she used to live on the Lake, and her kids who live out of state. That's one of the reasons that they used to have me had me on board. She wanted to. The kids said, "I never want to put." And she had dementia. She had Alzheimer's dementia.
God bless.
And they said, her daughter used to say, I'm not gonna lock up my mom because she says memory care. I just lock up places because they're not doing anything different to change to for the disease. So they're locking her up. So she said, no, I don't want her to lock up. And then she said, if something is wrong with her, I don't want you guys to run around back and forth to hospital with her either. Just I want her to be home as long as possible and be like, well, I want her to thrive. And so the other thing is with her, I want my mom to wake up whenever she wants to.
Yeah.
I don't want her to be an assisted living. She has to be up by 6 a.m. And
Yeah.
she does not wake up until 10. So she said, I want her to have her own schedule. So then that's where the holistic comes. She wakes up whenever she wants to. Usually she wakes up at 10 o'clock in the morning.
Yeah.
Okay. And then her day is structured like, okay, we don't have a structured day. It's whatever she wants to do. If she wants to get up, she's used to getting up and take a walk. We go take a walk with her. Now she's not able to express herself the way, but she'll take her walker and she'll knock it at the door. Boom. Like we say, oh, she wants to take a walk. And so we're not yelling at her because she's knocking the door, but this is her way of telling us, like, I need to go take my walk. And so she'll take her walker. She's like knocking at the door. And then, okay, let's go. We go take a walk. She comes back. She does whatever she wants. We have activities, whatever. She loves her magazines and she watches them. She cuts her magazine, whatever she wants to do. She has 3 bedrooms. She can walk in any one of those rooms whenever she wants to. And we just make sure she's safe. She does whatever she wants to. She drinks a glass of wine every day at 4 p.m. And she has that every day. And so her life was this. And she's watching. She wants to face the lake. She was right on the lake. And she's watching and she's living. She watched the birds. She feeds her birds. She goes to the garden. She does what she can. She lived with Alzheimer's dementia. Okay. She doesn't have to be locked up. She can live the life. She can eat what she wants. And the things that we feed, make sure that she eats the quality food because we're the one who's feeding her. All right.
Yeah.
We're feeding her. So we make sure that the things that she's eating is proper. Her sleep patterns, like whenever she's going to sleep, we make sure we have a whole routine, how she sleeps. In quality, we monitor her sleep at night. How is she getting up? Is she waking up in the night? Because we had a camera watching her. Is she waking up at night? Why? And then so we monitor her and didn't give her pills. She really didn't have anything. Like even with sundown, we find ways to make her quiet because we know the time between 4 and 6 and how she gets worked up and things like that. So we create activity around that. And she passes right in her home. And that's the story for her.
You know what, Emma? I love that story. And what people caring for someone with dementia don't understand is activities are as important to the patient as they were before their dementia diagnosis.
Yes.
And it gives them a sense of fulfillment. It gives them a sense of dignity. It gives them a better sense of well-being if they can do things that they love and enjoy. And it's also a way to avoid challenging negative behaviors that occur.
Yes. The reason that people place people with Alzheimer's and dementia at memory care units is because they are unable to manage the symptoms. They are unable to manage them. And so they think, well, what do you think when they put them in assisted living? There's no cure in there.
In fact, and having been a DON and have toured many memory care units, the majority of them are, and I will say 99.9% of them are just locked units to keep somebody safe. Should have activities around the clock for those that are sundowning or whatever, that they should have things that are in place. And they're not even staffing according to the acuity. So the people that have dementia, I hear horror stories of people saying their family member wasn't fed in memory care after they're paying like $10,000 or $12,000 a month for this unit. And they're even coming in and finding their loved one soaking wet with urine because nobody was in there to take care of them. And that's just, and I hate to say this, but corporations are taking money and because they're not regulated as a like other medical delivery systems are. The assisted living are taking advantage of that, and it's really sad. And
But
that's why I tell families you have to have, and you're a perfect example of why they need someone like you in this involved in these care in the care.
yeah, but when people say home care is more expensive, Miss Diane, they comparing one-on-one care and 1 to 20. Okay.
Yes,
So yeah,
exactly.
the assisted living can charge you $10,000 a month because they have 10 or 20 other people. They have 1 or 2 people taking care of them.
Yes.
So where at home you have one person doing one-on-one care. So it's all about what you want, what you're looking for. I have a doctor currently that I'm using some of her method for. She wrote a book on reversing Alzheimer's. Okay. And I'm using some of her method in my Alzheimer for my Alzheimer patients. She actually have clients. She has a memory care unit, Miss Diane, where she is applying just nutritional changes and
Interesting.
she's reversing people's behavior and she's discharging people from her unit.
That's amazing. I will tell you.
Just nutrition, just managing their nutritional level.
Wow. I do know that people can the caregivers don't realize that they have the ability to slow the process of the disease by providing good nutrition, exercise, getting them socially interactive,
Sleep,
other things.
hydration. Yeah.
Yes, and hydration, exactly. And those are things that are missed, I think, in the community settings like in memory care or assisted living. And that's why
Mhm.
I love that you're offering this at home because people don't understand what gem of how valuable this is to you to improve the quality of life for their senior, that you can actually delay the progression of these
The
and have
disease.
better quality of life for a longer period of time.
Yes. And those things sound so simple that Miss Diane, but
Yeah.
it's so simple. Why don't people do them? It's because they need a professional. They sound simple, but they need a professional point of view or
Yes.
aspect
Yes.
that we have a way of delivering those things that make it effective. To finish, let me give you a quick example. I had a client one time who called me this. I cannot get, because people with Alzheimer's dementia, we have issues with eating,
Yeah.
meds, they don't take their meds, or showering. Those are big
Yeah.
issues, and
Yeah.
families can get older people to do. So
Yeah.
he calls me. He says, "Emma, I just found all my mom's meds under her pillow. She has not been taking them. I give it to her, and I watch her, and she takes some, and she hides them, and things like that." She's like, and I said to him, "Okay, this is what we're gonna do today. Emma, how do I get her to take her pills?" I said, "No, no problems. What are the ones that are important that she must take? Okay, okay, let's go. Okay, I said, you gotta take applesauce. She likes applesauce? Yes. She likes, okay.
Yep.
We're gonna take these, we're gonna put them with applesauce. You're gonna feed them to her, you're gonna give it. She said, the first day he did it, he's like, Emma, you are so smart. I'm like, it's not smart, it's expert. I just,
Common
but it's common sense to me. Like to me, I've done it 100 times. We have done it 100 times.
tell you, people don't know how valuable our knowledge is. And here we
That's
are.
what I'm talking about. That's what I'm saying.
No, and I just want I want my listeners to know we are a wealth of knowledge. We know so much because we've lived life. We know the system. We know everything about it. We know the ins and outs, the good, the bad, the ugly. And we want to help. Just let us.
Yes, yes. And yes, we are experts in this thing. I go to a client's house and the wife has her husband who has Parkinson's and he's declining and he's at the edge of the bed. And she's like, Emma, how do I get her up? How do I get him up? I'm like, okay, let's put a pull sheet in this bed. Okay. She said, what's a pull sheet? I make a pull sheet and I put it in there and then we just screw them up. He's like, oh my God, Emma. Yeah, that's the expertise. That's what you pay me for. Yeah, they don't just come for free. I spent years learning how to do these things. Yeah,
Little
they're not
things
simple.
that make a huge difference. Just one tiny little thing that can make a life easier for the caregiver and the person they're caring for. It's huge. It's huge.
So that's why when someone asked me, what? I have to pay this for a caregiver? I said, no, you're paying for my expertise
Yes, yes,
because I am sending a caregiver with expertise and behind to take care of your mom with
yeah,
me behind them. And I give them instruction, guidelines, how to do. I take you, each person is different. I don't have a cookie cutter care plan. I have a care plan for your mother and for your father, what is going on with them. And I'm behind this caregiver to tell them, do this, do this, do this, do that. So that's what you pay for, not the caregiver.
exactly. So, Emma, what's one piece of advice you'd offer today to a caregiver who's feeling overwhelmed and unsure what to do next?
Get help.
I love that because,
Get help.
one of the most challenging things family caregivers do is they feel totally helpless and hopeless. And they also feel that they are a failure if they ask for help.
Yes, and the help is valuable, and there is value in it, and the help, and you can put a price on getting expert help
Exactly. Exactly.
because if you don't, you're doing it at the detriment of your own health.
Exactly. And with what's happening now in today's world with Medicare reimbursement putting more and more pressure on the family caregiver, we really need to let people know we're out here, we're here to support you. Call me.
Yeah,
Reach out to
I'm
me. I'm
telling you,
here.
Diane, you are a gift to caregivers to be able to have such an experienced nurse
Thank
been through so many things, who've seen so many things out there, giving people this kind of education.
And I'm 72 years old and I'm invisible.
Yeah. Yeah. And you are like, you bringing this body of knowledge. You know how in nursing we always talk the body of knowledge.
Yeah.
We have
Yeah.
this body of knowledge that is out there in the internet today with the technology. People anywhere can have access to you, anywhere in the world. They can
Yeah.
get access to this. And care in America is the same care everywhere. Every older person, no matter where they are, could get, should
Yeah.
should the best time of their lives. It's the most vulnerable time of their lives.
Yeah.
They should be able to get the best, even until the last breath on this earth.
That's my philosophy.
And I'm doing it for all for people. I hope somebody will do it for me too one day.
I'm hoping as well. My son's a CRNA, he's a nurse anesthetist. He puts people out for a living. So I'm not hopeful he's going to be able to take care of it.
Yeah.
I laugh about it, but that's nursing humor. To my family caregivers out there, I want to remind you, you are the most important part of the family caregiving equation. And without you, it all falls apart. So please learn to be gentle with yourself, practice self-care every day, and please don't hesitate to ask for help. It's a matter of survival because you are worth it. Thank you, Emma, for your time, and I'm looking forward to our next one.
Thank you for having me today.